You good?
It's loading. I'll tell you when you're good.
All right, and then you'll take the final slide. Do you want me to run through the rest? You want to do the intro? You want me to go? How do you want to start?
All right, we're live. I'll start. So hello, everybody. My name is Becca Meekins. I am the Assistant Town Administrator. I'm here with Kristen Black, who's the Health Director for the town of Northborough. We are here to give you an update on a COVID-19 employee training session. It's been a long time since you all have gone through all this, since the beginning of this whole pandemic. So we thought, as we close out the calendar year, it would be good to give people just a refresher, because it unfortunately doesn't seem like COVID is going away anytime too soon. So with that, I'm going to turn it over to Kristen, and she's going to cover just a lot of the facts about COVID and where we're at. And then at the end, I will cover some of the policies that we've put out and talk a little bit about what to expect in the new year. So Kristen?
Great. Thanks, Becca. We'll make this as brief as we can. If I go too fast, we're going to have these slides available for all of you as a slide deck. And also, if you have any questions as you work through this or listen to it, don't hesitate to reach out to either of us by email or phone. So today we're going to briefly cover really the 4 key elements of the Massachusetts mandatory workplace safety standards. So this is hygiene protocols, social distancing protocols, cleaning and disinfecting recommendations, and staffing and operations. So we'll talk a little bit about where we are right now, what current phase, provide a quick holiday and travel guidance update, and Becca's going to again go over those towns' COVID-19 policies. So just a quick introduction to this training. This presentation is going to supplement previous training requirements for employees, which included a training video that you all should have received that was prepared by Safety Net Compliance Solutions. So I'm going to skip over all of the hand washing, 20 seconds, all those fun details you've all heard about. I don't think we need to define social distancing again, but you did receive those before, and this is training video link is in the slide deck. So this training is all provided, and I'm following very closely along with the state's mandatory safety standards for workplaces. This is for all Massachusetts workplaces. Towns, municipalities are not exempt. This training also incorporates some of our sector-specific protocols, best practices, and checklists that are part of the Massachusetts reopening plan. And again, the resources in this presentation are coming primarily from the Center for Disease Control, the Mass Department of Public Health webpage, and the Reopening Massachusetts webpage. So quickly, it's always important to remember and go over how COVID is spread. And I know you think I've heard this 100 times, but since you're training in the spring, aerosol transmission is better documented and has been acknowledged by the CTC. So again, the best way to prevent illness is to avoid being exposed in the first place. And the virus is thought to spread mainly from person to person through really 3 sort of modes of transmission. One is through droplets. So you can become infected when those respiratory droplets, when an infected person coughs, sneezes, or talks. So again, we've all thought of that before. Don't sneeze on me. That's sort of obvious. The update is the aerosol transmission. So the CDC did revise its guidance to state that COVID-19 virus can linger in the air as small aerosols for minutes to hours. And so transmission can actually take place between people who are even 6 feet apart, or after an infected person has actually left a space. So it can be floating in the air. Fomites are the other 3rd mode of transmission for COVID-19, or the virus that causes COVID-19. So again, a fomite is just an object, right? So you may be able to, you could touch an object or a surface that has a virus on it, and then you're going to touch your eyes, nose, or mouth, and the virus can enter your body. You can become infected that way. So it's really important to note, the 3 places the virus can enter your body is your mouth, nose, and eyes. And it's important to note that people who do not show symptoms can also spread the virus. So that's pretty common. So it's not just sick people. So again, here's just an image or a graphic to sort of show you. So fomite on the left, think of this like door handle, the droplets of the virus are on the handle, and then maybe you go and eat your lunch and you didn't sanitize as you entered the building and put your hand to your eye or something like that. Droplets, again, those larger particles we think of, they typically fall to the floor. They're affected by gravity. And lastly, the aerosol, which is a much smaller particle that's actually floating in the air for, again, minutes to hours. I know we talk a lot about 6 feet. I just want you to keep in mind that's not this magical bubble of 6 feet that prevents all transmission. Again, a sneeze alone or a cough could go as far as 9 meters. So there's nothing really magic about 6 other than it's a general standard that we look at, especially when defining close contacts and things like that. So let's cover hygiene very briefly. Again, this graphic is was taken right out of the mandatory workplace safety standards. So we want to make sure that there's hand washing throughout the workplace. I think we've all covered that. We want all employees to wash their hands frequently, and we want to provide regular sanitation of those high touch areas and workstation, like equipment, screens, doorknobs, and restrooms, et cetera. So I'll cover some of that here. So again, we want to think about hand washing during COVID, so during the pandemic, it's really important to wash your hands after you've been in a public place. I mean, the workplace is a public place for the most part. So if you're touching an item or a surface at your workplace, the door handle, the light switch, the handrail coming up, if you're sharing items or tools, the keypad on the copier, those are items where you would want to wash your hands or use a hand sanitizer after that, and always before you're going to touch your eyes, nose, or mouth. So always before eating, if you have something in your eye, wash your hands, disinfect, etc. So hand sanitizers, I just want to state that soap and water is always the best option to get rid of germs. If you can't get to a hand washing station or it's not convenient at that moment, use a hand sanitizer. Any of the ones you're using should show that 60% alcohol. So check the label. And then again, the sanitizers reduce the number of germs, but they can't get rid of all germs. So sanitizing isn't going to get rid of every single germ. So just keep that in mind. If your hands, if you're, I don't want to pick on DPW, but your DPW, you're out there, hands are all greasy. That sanitizer can't be that effective if you had a lot of visible dirt or your hands are greasy. And hand sanitizers can't remove chemicals, etc. So wash your hands in those cases. So social distancing, I think this has been beat to death, but overall, this again is the sketch from the mandatory workplace safety standards. We want all employees, customers, vendors have to maintain this 6 feet to the greatest extent possible inside and outside workspaces, so indoors and outdoors. We've established protocols to ensure this can take place. For example, moving desks, adding plexiglass, all those sort of things. There should be signage throughout the buildings, wear your mask, social distancing, etc., markings on the floor where necessary. And again, we'll go over the requirement for face coverings for employees. So this is sort of all new, very specific to town of Northborough and what we're doing in the moment. So here are best practices on social distancing. So we're at this exact moment. We're at the peak of the pandemic. I'm not talking, well, I hope it's the peak. It's the peak for us right now. We're over twice the surge we saw for total case counts that was documented in the spring. So it's a hot time for COVID transmission. So for the reason we're asking that all meetings at this time are going to be held on Zoom. We're going to be doing no in-person meetings. We really want to discourage and stop the practice of popping into the office. Just stop in, say hello, happy holidays, what's going on. I just was down at your end of the wing using the restroom or the lunchroom. I just wanted to, ask you a quick question. We want to try to refrain from that. Not forever. We'll get back to normal, but for now, we want to keep private office doors closed. So I'm in my office now, especially if I want to have my coffee, take my mask off, eat my lunch, close that door. Try to keep those doors closed. Shared workspaces should only be occupied by one staff member at a time through December 10th, and that may be expanded. So if you have an office space where it's sort of open air, there's 3 desks, they may be 6 feet apart. That's great, but we really, right now with the shifts, we want to try to only have one person in that shared office open space at a time. Town Hall mailbox is now on wheels. You will find it in the hallway of Town Hall, at least for the foreseeable future. So during business hours, we want to keep our staff from entering the town administrator's office. So you can get your mail in the hallway. That will be returned at the end of the day to the town administrator's office. We want to avoid lingering in shared spaces, bathrooms, kitchens, etc. for discussions. If a shared space is occupied, again, someone's microwaving their meal, etc. Bathroom, you see a couple people in there. Let's try to consider returning another time. Again, avoid sharing. So tough around the holidays. Leave the cookies at home, bring them back, later on, freeze them for summer. I'm not sure, but we're not going to be sharing food and drinks in the break room. So if you have some extra snacks, please refrain from leaving them out. And carpooling, we definitely, you know, I don't know how you handle going to work. I don't think we have too many carpoolers, but if you are both going to a site visit or something like that, you know, you should avoid carpooling. If it's, you know, are essential or first responders, if it's essential, masks are always required if you're in a vehicle with someone that is not in your household, and that's under the governor's mask order. So again, social distancing, just the graphic. So we are currently, we're in the COOP plan, or the continuity of operation plan is implemented at this time. So shifts are required to limit the number of employees in the workplace at the same time. If you have questions about your COOP and where you stand, please reach out to Becca, the town administrator's office, or your supervisor to figure out where you stand in that. Face coverings, again, this was updated recently by the state. So face covering is required at all times unless you're seated at your desk in your workspace at least 6 feet from others. We want you to close your doors, and if you have that private office, to remove those masks. So we really, mask wearing is very important. If you get up out of your chair at all times, you should have a mask on. There really shouldn't be any reason you wouldn't be putting it up if you're walking around and through the building, you know, in parking lots, up and down the stairs, etc. Face coverings, just some more details. So surgical masks are available upon request for work use. We do have plenty of them. So, you know, I have heard some rumbling, surgical masks can be better. The best mask for everyone is a mask you'll wear, a mask that fits snugly. And ideally, you know, masks need to be at least a minimum of 2 layers of material. Neck gaiters are not allowed by the town policies. Again, it should fit snugly on the side of the face. You want to avoid touching your mask. Obviously, only remove it, you know, by the straps on the ears. If a mask does not stay up around your nose, try a different kind. So we do have some different types of surgical masks. You know, there's some people where it's constantly slipping. It just doesn't fit. Find a mask that fits you right. And if it's a cloth mask, it should be laundered daily. So cleaning and disinfecting. So under the mandatory workplace safety standards, we must establish and maintain cleaning protocols specific to the business. If an active employee is diagnosed with COVID, we'll go over some of the cleaning and disinfecting. Obviously must be performed, and we're following the best standards on that practice and looking at every individual case. And disinfection of all common surfaces has to take place at intervals appropriate to the said workspace. So I'll cover that. This graphic is from the CDC. So it's a, you know, clean, sanitize, wait. I really want you to think about cleaning in that order. So cleaning is what we think of washing your dishes at home. That's really just removing visible soil and dirt with soap and water. Okay. Disinfecting or sanitizing. It's really, that's about using a EPA registered disinfectant that will kill pathogens, including COVID-19. It's really important that whatever we're using as a cleaning product, or a disinfecting product, is actually registered by the EPA. So we do have an EPA N list. If you have any products you're unsure of in your office, please reach out to me. There is an EPA reg number on any cleaning product, and we'll make sure it's actually listed. And probably the most important and often forgotten step is to wait the mandatory time. So you need to not only use the right product, you need to use it in accordance with manufacturer's directions. So there's always a wait time there. Want you to take a look at that and make sure you're following it. So I'll give you a little example here about this new product. We did drop off these wipes plus disinfecting wipes to many of the offices in town, and more are available. This is for work use. So for example, town hall custodial staff is currently disinfecting all high touch surfaces once per day. Staff are responsible for disinfecting their own workstations at least once per day is what's recommended. So think of your phone, your mouse, your keypad, you know, the area you're working. Best practice is also to disinfect doorknobs, light switches, etc. at the end of the day before the next shift. So we want to follow the proper procedures again to disinfect. So we need to know what we need to disinfect and when and how. So we need to use, again, the approved products in accordance with manufacturer's directions. So for example, this wipes plus disinfecting wipe can be used on hard, non-porous surfaces. So pretty much most of your office surfaces, it's appropriate. According to the directions on the back, you need to wipe the surface until it's visibly wet. So one wipe may only clean a couple surfaces. Use what you need to make sure it's visibly wet. You need to leave it there for 4 minutes. And then you always want to wash your hands after disinfecting areas. Just want to go over these high touch areas I'm talking about here. So this is handrails, doorknobs, and handles, elevator buttons, equipment, phones, water cooler, microwave. So anything you're touching. So again, if you want to think about disinfecting those at least once daily, and also sanitizing or using a hand sanitizer, washing your hands after touching these high touch surfaces. And so it's really important we disinfect these shared items between uses. So you should grab one of those wipes, leave it in the office near the copier keypad. If more than one person uses it, you should get in the practice of actually disinfecting that keypad after the use. Similarly, shared spaces like conference tables. If you're going to need to go spread out on a conference table, that's great. Give it a wipe down before you leave. And just speaking about indoor air quality, some offices, town hall at the moment, I know there's some more orders going in. There was a shortage of the product, but we should be getting more of these HEPA air filter purifiers. So we want to make sure if you have one in your office, don't worry about the electricity. Just leave that thing on auto and let it run. I don't want to hear you shut it off. It was a long weekend. Just let them run. We also want you to consider opening windows to improve that fresh air flow. I know it's tough in the winter, but that, fresh air flow is important. I would say with windows, leaving them open, the weather can change over the weekend. Use common sense. You probably want to close those windows up, obviously, before you leave at the end of the day. So talk a little bit about staffing and operations. So again, here's the image from our mandatory workplace safety standards. So this is part of the training we're providing for employees on social distancing and hygiene protocols. I'm also going to cover that employees who have COVID symptoms do not report to work, and that we need to have a plan, and we do, that if anyone is ill at work, and then we have a return to work plan as well. So those are all in place right now. Just a quick slide here. I want to bring to your attention that the CDC did update its list for individuals at higher risk of illness from COVID. This is a screenshot of the first list of who are definitely are at increased risk if you have any of these conditions. There's even more listed on the CDC's webpage. So if you are not sure if you're higher risk, I'm going to refer you to the CDC's website. Talk to your primary care provider. And if you are higher risk, that's something that you should speak to your supervisor if you're concerned about that in-person work options. So symptoms for COVID-19, let's jump to this again. Since your last training, this has been updated. I think the list back then, there were maybe 7, so we have quite a few more. So again, symptoms of COVID-19 are wide ranging: fevers or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So again, symptoms can be very mild to severe. You may have 5 of these symptoms, you may have 1 of them, you could have none of them. But symptoms typically appear 2 to 4 days after exposure to the virus that causes COVID-19. So it's important to note that Massachusetts just put out the stat: 50% of the COVID-19 cases are of unknown exposure. And so they can't determine, what the source of the infection was about half the time. So please do not assume your stuffiness, your mild headache, I'm feeling a little tired today, is just, an allergy or a headache or whatever. It's something normal. And you just come to work and we tough it out like we always want to do because we're dedicated employees. This is not the time. So if you think you have any of those symptoms, as however mild as they may be, please play it safe. Do not come to work. So again, all employees are asked to monitor for symptoms. So you guys should all be considering monitoring for symptoms before you come to work. Be very familiar with that list. We don't have a formal process. We are not mandating temperature checks or anything at this point that I know of, but it's really important that you know the list, you consider that list, you don't come to work if you're exhibiting any of those symptoms. And again, if you do have any of those symptoms, you want to contact your healthcare provider as soon as possible, and they're likely to recommend testing. And so again, if you're feeling even a little off, please stay home, notify your supervisor. So if employees are displaying COVID-like symptoms, you would notify the supervisor immediately, stay home from work, and again, contact your healthcare provider to get tested. If you do test positive, please contact your supervisor as soon as possible so we can make sure the workplace is safe for everybody else. A return to work plan for individuals or employees with COVID-19. You can't return to work until you've met the criteria to discontinue that home isolation. And that is going to be in consultation with your healthcare providers and local public health. And we work that through with the HR department. So make sure you touch base, even if your doctor says you're good to go. If you did have COVID, let's make sure that we're all on the same page as to when you're returning. And again, yeah, if you're not sure, if you haven't been contacted by local public health where you live or your doctor, please reach out to Becca or myself. Employees who are exposed to positive COVID-19 persons or people. So this is becoming more and more common as we have more cases. I'm sure everybody knows someone who's been with someone who has COVID-19. So there's a process for that. We really look at, there's a certain window in which someone's considered infectious under the Mass Department of Public Health standards. So it's really important that you would reach out to us to make sure that we're following state guidance. So you may be required to quarantine for 14 days. And again, you want to notify your supervisor. And the health department, I'm here to work with you. Becca's getting really good at it too. We follow what the CDC defines as a close contact. So the definition there is anyone who's been within 6 feet of someone for 15 minutes or more cumulatively over a 24-hour period, when they were considered infectious. So you don't need to learn it all. You just need to call us and we're going to make sure everybody's safe. So if somebody calls you, said, I have COVID, or you get a call from your dental office or your gym or anywhere, just run it by us and we'll make sure we're following the protocols. So again, there's also protocols for responding to scenarios. So if we do end up with a case in town or a close contact, those sort of things. So the town administrator's office has developed these response plans. Want you to realize that every situation is different. We look at every individual case as to when the person was infectious, did they last work, what areas of the building were they in, and we'll make sure that we're following those best practices. And we're modeling this off of the Center for Disease Control, the Mass Department of Public Health, and the DESE, which is the Department of Early and Secondary Education, has some great protocols for responding to these scenarios. So we'll be working through those individually. Just lastly, quickly, holiday guidance and travel. All staff are urged to follow public health guidance to keep themselves, families, our staff, and communities safe. So the Mass Department of Public Health recently released some holiday guidance. They're specifically asking everybody during this holiday period to limit in-person celebrations to household members only. We're advising you to postpone or cancel travel this holiday season. If you do choose to travel, you must comply with the Massachusetts travel order requirements. Becca also has a policy on that specific to staff. And then again, the Mass Department of Public Health asks that you follow current state gathering size limits and all the sector specific workplace safety standards, which we are. So I'll hand it back over to Becca.
Thanks, Kristen. So I know that these 4 policies have gone out to all staff, so everyone should be at least aware of them. I would encourage you all to read them thoroughly. If you have questions about them, talk to your supervisor. They can come talk to us, or you can always come talk to me directly if you have questions. The leave guidance memo is likely to be updated in the new calendar year. We are waiting to see if the state government extends the FFCRA. We have not heard anything yet, but this policy will likely need to be updated at the expiration of the FFCRA, which is the Family First Coronavirus Leave Act, which is set to expire at the end of December. So just keep an eye out for that. We'll be sending that out to folks as soon as we know more information. Safety standards and return to work. This policy is also likely to be updated soon, as Kristen mentioned. We have been developing some response policies when there's an exposure in a town building. We had been fairly lucky up until recently regarding exposure and positive test results. And unfortunately, with the recent surge that's going on, not just in Northborough, but statewide and throughout the country, we are seeing an increased number of positive cases and exposures. So we're going to make some adjustments to that safety standards and return to work policy. I would keep an eye out for that. Expect that to be out also by the first of the year. And then in addition to those 2, we also have the temporary telecommuting policy, which will stay in place really until further notice. We want to encourage staff to be flexible with each other. And, you know, whenever you are able to work from home, if it's possible, we want you to be doing that, because at the end of the day, that is the best way to keep people safe and to reduce exposure. And then lastly, the travel memo, which is basically mirrors the state's policy on travel, which gets updated pretty regularly. You know, we really want to discourage people from traveling if at all possible, especially right now with the surge in case numbers. It's just a really high risk activity. And being that a lot of us are essential employees, bringing that back into the workplace just isn't good for any of us. So like I said, read through those policies thoroughly, reach out if you have questions, happy to answer any questions or talk through any of them with you. And again, if anybody has questions about any of this stuff that we've gone through, you can talk to your department head, your supervisor. You can always come to me. You can go to Kristen. Kristen has been phenomenal, staying on top of the changing regulations. I mean, things are changing almost every day, it seems now. So everyone's head is spinning a little bit. We understand. We want to be flexible, understanding, provide as much information as we possibly can so that you feel equipped to protect yourself and your loved ones to the best of your ability. I will also say that this has been a taxing time on people's mental health. I know that we have talked about it, we've heard about it, but I really encourage you all to do things that relieve stress in a safe manner, whatever those things may be. Please do them. If you need assistance, we do have EAP and employee assistance, which is available to all staff. If you'd like information about getting in touch with them, I can provide that to you. But really just, these are challenging times. We're doing our best to work through them. And we want to keep you both physically healthy, but mentally healthy as well. So keep that in mind. Is that the end of the presentation?
That's the end.
All right.
Okay.
So thank you guys. I'll wrap it up. Thank you, Kristen. This has been great for staff. I hope you found this helpful and informative. And again, reach out if you have questions, and happy holidays.
Thanks, everybody.